National Women's Health Week, and here to help us celebrate is the health and fitness editor with Women's Health magazine, Jen Ator. Welcome, Jen. So, I know you have a special edition of our Ask Anything column in Women's Health.
Yes. We're the official partner with Women's Health Week, and we're really pumped. It's just all about empowering women to be more informed and feel like they can make accurate choices about their health and wellness for themselves, and kicks off May and ask questions that might be embarrassing.
No question off limits here today, too?
Nothing.
And I love these forums, whether it's your magazine or our television show for women and men as well, obviously during Men's Health Week, but to ask questions that they may be concerned about. We're going to get to one right now, and it comes to us from Sarah, who is back in our medical confessional. So, Sarah, tell us what's going on.
So, I actually want to know, like, how much discharge is normal, I guess. I never really knew that it was anything unusual until I was hanging out with my sister. She was helping me move, and she basically asked me if I had a yeast infection, and I was just like, no, I don't have a yeast infection. What are you talking about? But I never knew that it was anything unusual until that moment. So since then, I've been kind of like, is it not normal to actually have discharge?
Discharge is normal, and what's normal for you, it may be different than what's normal for your sister. And since this has been something that's been consistent for your whole life, I wouldn't worry about it. The thing about discharge is that it's basically your body, your vagina sloughing off epithelial cells, and that's a totally normal process. Normal vaginal discharge in a young reproductive age woman is usually a clear white color, and it can be, a small amount, a scant amount. Some girls have more discharge, will have to wear panty liners. Sometimes discharge is more during certain times of the month. So, just because your discharge or the amount is different than your sister's discharge doesn't mean that yours is abnormal.
And that's the big thing we're always trying to tell our readers too, is to be proactive. So normally, a lot of women don't pay attention to this until after they feel like it might be a problematic symptom that they're experiencing. And then when they go to their doctor, they can't really explain what their past normal is. Right. So there's a lot of free apps, like free menstrual calendar apps that you can use on your phone just to kind of track your day-to-day. And we're always saying to people...
To track your discharge, too?
Yeah. Because then when you show up to the doctor, you can say, well, here's what it was a month ago, and you definitely would have already forgotten about it. And, okay, now I can see that there's been a week of this or that.
And it can give you clues as to when you're ovulating. It can give you clues as to if you have an infection.
The biggest thing, Sarah, is a change for you as an individual. And if this is something you've dealt with your whole life, then that is normal for you, and that's the case in most of these scenarios. I applaud you, Sarah, for asking this question, because it is certainly a question a lot of women have.
Good question.
Well, we do have time for one more question. It's via Twitter. Is it true that you're more likely to orgasm on a certain day of your menstrual cycle? Well, doesn't it depend on who you're dating during that menstrual cycle to some extent? Just throwing that out there.
Ooh, la, la. Well, during the time of ovulation, which is about mid-cycle, it's called the luteal peak. There's increased hormones that are released that can enhance sexual feelings, libido, arousal, orgasm. It can enhance genital sensations. So, I think that's part of our reproductive cycle and reproductive health.
But I think the big thing, too, is understanding that female arousal is so different, from men's. It's not just about blood flow or something cut and dry. A lot of it's mental, too. So I think
our minds start thinking about it.
Right. And I think women get caught up in, oh, well, it's day 14, and a study found that that's when I'm supposed to be the most turned on.
Yeah.
But then they get kind of caught up and they're like, so why am I not? And you start getting in your head. And I think we're always trying to encourage readers to really try to just be more in the moment and not overanalyze. And remember that arousal is also impacted by things like sleep and diet and exercise and drinking and smoking and all these different factors, that just because it might be that time of the month that you should be feeling a certain way.
So you're saying...
And if I may, sometimes the best advice for women comes from men. Don't ever tell your husband, well, it's day 14. You better perform, buddy. Because all that pressure just doesn't work well.
Right.
It just doesn't. Look, I love these topics because they are considered in many cases taboo. Such great things to discuss. And one of the best things is these topics are covered in Women's Health, and everyone in the audience is going home with a 1-year subscription to Women's Health magazine. And for you at home, head to our website to enter for your chance to win a subscription as well.